Hello and welcome. I'm Dr. Sonali, scientific editor of the Spark, Kaho. On the occasion of World Patient Safety Day, we are bringing you a special podcast around this year's WHO theme, which is patient safety from the start. Every child deserves a safe care. Today, we will be joined by our esteemed guest to discuss how ensuring safety right from the beginning can shape healthier future for every child. I am delighted to welcome you, sir. Dr. Sayeed is here, who is an esteemed specialist pediatrician and medical director based at Aster Clinic within the Aster Jubilee Medical Complex at Dubai. So, before we start, sir, I would like you to tell us a little bit about yourself and your journey as a pediatrician.
Thank you, Sonali. Sorry. You have already given a brief introduction about myself, but still, I would like to tell you something more about it. See, I'm of course, I'm a pediatrician. See, I started my journey maybe from as a pediatrician. It is from Qaboos Hospital in Salalah. That's a tertiary hospital where I got an opportunity to work there. Frankly speaking, that is one of the best experiences which I can remember it, because you will be surprised if I tell that the hospital, some of the days, weekly once or twice, I was having 36 hours continuous duty. Even 7 o'clock, 7:30 when we go there, the next day only 2 o'clock only I will be leaving. That is the way we were practicing. But I'm very happy about it right now, because one thing, as a pediatrician, that molded me as a pediatrician, because you are encountering with it's a tertiary hospital. A tertiary hospital, that empty number of cases, any case which is coming from different parts of, and Salala is a place where see, there is no, it is little detached with the Oman. It is in Oman, yeah. So it is little detached. So all the cases which are in that particular area, where all the cases were referred to this hospital, and I got a very good experience from there, thanks to Qaboos Hospital. That is one thing. So then I got an opportunity to come here. See, here, actually speaking, I came little early here. I appeared for the examination. I passed the examination. Since I was working there, and I had to go back to Oman, and then I came back to UAE. Of course, with the honorable chairman, Dr. Azad Mopan, I got an opportunity to be with a part of this journey. And proud to say that, I am the first pediatrician to start this department, pediatric department. And then after that, it was a wonderful journey, a remarkable journey, maybe more than 37, 38 years. Now, Aster is celebrating 38, 39 years celebration. And I am also a part of that journey. And I'm very proud to say that I'm an Asterian. An Asterian from the very beginning. My number was number 2 from in Aster. That was the that was my credibility, which I always talk to many people. See, really proud of that thing. And that way, we started in the early stages. There were not many clinics here. There were not many hospitals even. No, after that, when we came here, we actually, it's a vision by our chairman. He started one clinic, then second clinic, third clinic, fourth clinic. It is an expansion. And I'm again proud to say that, we are the role model for many of the people who are doing a business right now, multiple clinics, networking clinics, only because the way they saw us, how we are growing, and they are followed. That is another part of Aster, which I am proud of that. So just, when you are asking journey, my journey is completely, my full, this thing is with Aster only. Because, 38 years, I could spend with Aster. That means, Aster has given me everything. What I have, I don't know what contributed from my side, but I'm fully satisfied with the way I worked with the Aster. That is one thing. So today, we are celebrating, maybe, it's a wonderful day for us, because, we have got, I forgot to tell you that, now you said that, I'm the medical director. Of course, I was the medical director for the Jubilee Medical Complex. Then I have been promoted as the group medical director, and I was the group medical director for the Aster group. Then when we started, the divisions came. Then I have been assigned to look after the Aster clinics and the Access clinic. For your information, we are the largest networking clinic in this part of, no, not only here, in the whole world. We have got only one competitor in the world, that is NHS. It's a government sector. So we are having the largest network, nearly 82 clinics where we are just looking. So that way, so a lot of doctors, I got a opportunity to be with the patient, be with the parents, and be with the doctors, and be with our management. See, that is one journey where I'm just remembering that thing. So in nutshell, I can say it's a remarkable journey.
Of
Till
course,
now.
sir. It sounds very amazing that you've been included in various roles. Since we are talking
Yeah.
about the World Patient Safety Day here, the safe care for
Yeah.
every newborn and every child, patient safety from the start. As a pediatrician, what does this theme mean to you?
See, WHO, defines safety. See, as pediatricians or as a doctor, we are, giving help to the patients. That is a part of our, it's a duty, it's a part. But at the same time, WHO reminds us that, just giving help is not enough. You should not do any harm. That is the most important thing. See, a child can come to the clinic where, there are a lot of, areas where we can give some harm to the child. For example, maybe a fall, a child is coming to this thing, the wet floor, it can be, or we will not be even identifying sometimes, if you are not identifying the baby, the correct baby, or if you are giving an injection, errors, a lot of things can happen to the baby. So, we are living in UAE. I should proud to say that, I'm living in UAE, and because of the government and the authorities, this is one of the safest place in the world, and safest. You asked me about the safety.
Yeah.
So I'm telling about the safest. Safest in one of the safest countries in the world is UAE. Why? How they made it? This is only because of the leaders of this country and the governance. So their governance has made, this country is the safest. For example, any lady or anyone can travel at any time. That is what, WHO says that, in anywhere, anytime, when in our facility, when anybody is coming, so we should give the protection and the safety to the patient. Similarly, you can travel anywhere in UAE because without any fear. You don't have to worry about somebody will... a thief will come and this thing, somebody will shoot you, somebody will harm you, nothing. That is, it is a combination of, safety by the government is providing, at the same time, it is our duty to give safety to the patients. So that is one thing which, I'm just this thing. And we are, as in Aster, we take, and our quality department and medical affairs, which I am also involved in that thing. We take utmost care to give the best ethical practice and the best practice, whatever possible to the patient, we are trying to give it. That's
Right,
it.
sir. So, as a pediatrician, what was the very first step you take to make sure that every newborn receives safe care from the start?
Yeah. See, what is, when when a lady, where the safety starts? From the womb itself, the doctors have to see that, not after the delivery.
Right.
From there itself, we have to give extra care to the mother. The mother should be aware of this thing. We should teach them. We should be telling them that, see, what is the pregnancy problems, what are the delivery problems, after the delivery, how you should take care of the baby. All these things in advance, we have. That is called the awareness to the mother, awareness to the parents, awareness to the community. When a baby, immediately after the delivery, the most important, see how the delivery should be conducted. That is also very important. Hygiene is the most important part. Hygiene. See, in an environment, if you are creating an environment where hygiene is given the utmost importance, in quality, we stress the point hygiene. We stress the point cleanliness. We stress the point, see everything, again, safety. We always make our people that, safety is most important thing which we have to. So that is the most important thing which we have to. So when a baby, at the time of delivery, two, three things which you have to see. One is the hygienic part. Second, we should have the best professionals. The
Right.
professional should do the work. If the professional is not doing this delivery, definitely, there will be complications. There will be a lot of problems after post-delivery period. So that is another thing, which we have to take it. Then, actually, when you are taking the precautions, care for the mother and child to be ensured. That is most important thing. And after the delivery, I always tell my patients, the mothers, what is the most important thing? What is the God's gift to the mother? The God's gift to the mother is the breast milk. Ensure, ensure again, and ensure again. You give only breast milk to the baby. Don't give the bottle. Don't give, because there are plenty of advantages for the breast milk. So
Right.
that is where you have to ensure and make it sure that the before the delivery, safety part is there. During the delivery, hygienic part and all these things are taken care. And after the delivery, tell the mother what is the next you should follow. Give them the awareness and tell them that your God's gift is you, give it to the baby. Don't deny
Right.
it.
Right.
Deliver it. That's
Yes.
all.
I agree, sir.
Thank
The empowerment and awareness is very important for
you.
everybody. So,
Yeah.
sir, in line to that, if we could send one message to our policymakers on this WPSD day, what it could be?
Policymakers. Yeah. See, that question is very, very important at this time, because in UAE, see, if you are asking me, as I told you, the government has already made it mandatory that, see, everything, safety part and everything is here. Still,
Yeah.
other people, other governments who are not giving that much of importance to the safety part. The most important thing, a strong law, a strong that law should be very stringent. See, you say that this should be like that. That is called the governance. I already mentioned about the governance. A good governance will always make a country a better country. So
Right.
similarly, if you are having a better policy and better protocols for the safety part, definitely, see, there will be a better, we will take care of the safety part of the patients. That is the most important thing.
Right.
So definitely, see, another thing, maybe, see, if you are asking me the second question, you ask me what is the next one. See, you should get an access to the clinics. 82 clinics we are already having, I told you. So in UAE, when we are having this many clinics, no, the people have access, and our see, Aster clinic policy itself is that it's a family clinic, neighboring family clinic, where we are trying to give the affordable clinic.
Right.
See, it should be affordable to the patients. Yeah,
Of
it
course.
should be accessible to the patient. So that is the clinic which we are planning every. In every community, we ensure that there is a clinic in every community. See, Dubai is a growing country where they are making a lot of new communities. But where you just see that wherever we are having one clinic, one pharmacy minimum, we are having it. So that is the accessibility.
Ah,
That is most important. Yeah, most important thing is that see, we have to provide that children access to the clinic, so that they will be taking care of this thing. That is the most
absolutely, sir.
important.
Absolutely, sir. I agree that it is right for every patient that they get everything from the healthcare sector. So the next question in line with the previous question, like how the parents and the caregivers who are the first line of response when they are with the newborn or the toddlers and the adolescents, how they can actively contribute to making a safer care for them.
A good question. Actually, it's not, it's not only the parents' duty. It's a collective effort. See, children spend some time at home, most of the time in the school. Sometimes, they will be with the caretakers. They, after the school hours, they may be completely taken by working parents, in UAE, or majority are working parents. So they leave the child with the caretakers. And school is also, so it is a collective, and clinic, hospitals, all this, it's a collective effort. We cannot just say that, see, children's safety is lying with only with the parents. So parents should take care of all these things. No, it's not possible. Impossible thing. We are asking the parents to take care completely. But, start with the home. At home, there are so many risks the children can encounter. See, they are, as I said that, they are so energetic, so enthusiastic, so explorative. They just want to find everything, see, jumping from chair to another chair, see, running around, hitting the walls, see, maybe, the mother is cooking, go there, pull this thing, burns. All these risks are there at home. So that parents have to take care. How that, this thing, as much as possible, make them understand that, this is called the education. Health education is very important. So awareness and health education, even, you are asking, we were just starting with the international safety. So in the international safety also, they are insisting that awareness and education, health education is a very important matter. So it should start from home. Then it should start, give it to the caretaker. Even if you are giving to the children, to the caretakers, you should make them understand that even nutrition is a very important part. Yeah. You prepare at home good food. Maybe what type of food? That is also very. Obesity is one of the major causes in developed countries and developing countries. Obesity. Yeah. How obesity? Because see, children, see, they just eat whatever they like it. Some children, they don't do any play. They will sit, watch cricket, and today it is a digital age. So digital age risks are also there. So all these things, we have to take care of that. So at home, similarly from play area, another area where these children are at risk are the play area. They jump, they run around, they just jump, try to jump from high, fracture, fracture in the leg, fracture in the hand, all these things, So awareness and health education is the most important thing, which we have to make them understand, so that, children will, it is not, punishing them. See, some parents, they will, some children are very hyper energetic children. Some children are very hyper energetic. In the class, I have seen that, some teachers were coming and telling, my God, doctor, it is very difficult to control this boy. Very difficult. Parents are also coming and telling, every time teacher is complaining, it is very difficult. Because they are hyper energetic children. Already they are energetic. But, some of them are hyper energetic. They cannot sit in the class. In one place, they cannot sit. They want to run around. In the class, how they will run around in the class also. Yeah. Then teacher will all these things, all these are, there are so many risks, these children are encountering. So that we have to make sure that, it should be this thing. This is what, I have to tell so that's what I said, that, it is purely a collective effort. It is not like with one person or one parent or one teacher. No, it is a collective effort.
Correct. Absolutely, sir. So before we conclude this conversation, I want you to give one message to our viewers and listeners on this World Patient Safety Day.
Yeah. Take care of yourself, take care of your children, and take care of the community. See, you have got a lot of things to contribute to the community. Lot of things. We can contribute a lot of things to the community. Even, see what, as a parent, your experience can be shared with the other parents who are newly wedded people. To them also you can give the advice. To the newborn babies, see, their parents, you can give the advice. And everything, if communication is very important. We are living in a world of communication. So it is easy for us to, pass this communication to many people.
Thank you, sir. Thank you, sir. Okay. Thank you for joining us today on this special episode of the Spark Podcast on the occasion of World Patient Safety Day with the theme of patient safety from the start. Every child deserves the safe care. We hope this conversation has highlighted the importance of safe, quality care for every newborn and the child. Let us all work together, the healthcare providers, their families, and the communities to make healthcare safer from the very beginning of the life. I am Dr. Sonali, scientific editor of the Spark. Thank you for listening. Thank you, sir, for joining us today. Thank you.
Thank you so much, Sonali. Thank you so much for giving this opportunity. Thank you.
Thank you, sir.